Hey everyone, this video is going to be about pneumothoraxes for EMTs. So that means that this is going to be related to EMT, that scope of practice. So it won't go any further than that. But I want to talk about first the pneumothorax in general. So it's also commonly called collapsed lung. And the actual definition, which I like to just get down so you kind of know exactly what the official definition would be, is an accumulation of air or gas in the pleural cavity. So basically with the lung you have the parietal pleura, and then you have the visceral pleura, which is the actual lung itself, and then in that is a little bit of space. And with a normal lung, that space is relatively general. It's kind of small, it's not too big. But with a pneumothorax, that space gets accumulated with air, and that air could come from multiple things like a puncture or even disease. So caused from trauma or illness. And so basically this is just a general picture, but here's a better overall picture of it. My great drawing here, but sometimes simple is better. You have the lung, which is in the purple here. You have a wound site that could come from any different cause. In that air starts to escape into this pleural cavity, and it could develop into multiple things like a tension pneumothorax. But basically, a pneumothorax is when it doesn't necessarily affect any of the cardiovascular. I'm sorry, that's a different thing. Sorry, we'll get into that in a second here. But so basically, just overall pneumothorax, air enters through the hole in the chest wall or surface of the lung as the patient tries to breathe, which causes the lung on that side to collapse, and any blood that passes through that collapsed portion is obviously not oxygenated, and so it could cause hypoxia. And for diminished breath sounds, which is a finding with pneumothorax, it's past 30 to 40%, which is a good amount. So breath sounds may not be diminished right away. It doesn't rule out the possibility of a pneumothorax. But with a pneumothorax, there's also something called a open pneumothorax, also called a sucking chest wound, and that's when there is a hole in the chest wall, and then air enters the pleural space, which again is this area right in here, through the outside. So after clearing and maintaining the airway, applying O2, you want to apply an occlusive dressing, which basically prevents the air from getting in, because it's sealed. It's not just there's no space in there for the air to get in. So you want to also apply a flutter valve to that, which you would, if you did it just kind of on the fly, it would be like taping something, like something that's sealed on three sides. And the purpose of the occlusive dressing is obviously, like I said, to seal the wound and prevent air from being sucked into the chest, and that flutter valve allows air to exit the chest. So 3 types of pneumothorax overall. Like I was saying before, is a simple pneumothorax, and that's any pneumothorax that does not result in any major changes in the patient's cardiac physiology. So no change in vitals and things like that. It's hard to diagnose, obviously. If there is no change, it's hard to diagnose that, but some common findings are dyspnea, difficulty breathing, increased rate of breathing. So, say a patient's breathing at 30, 25 beats per minute, or not beats, breaths per minute, that would be a sign. Accessory muscle use, decreasing oxygen saturation, and subcutaneous emphysema, which is it's like a crackling sensation when you palpate the skin, which means that there's air under the skin. This simple pneumothorax can turn into a tension pneumothorax or hemothorax, which I'll get to in a second. So that means that just because there's nothing significant going on, doesn't mean that it can't become something significant. In treatment, you just want to apply oxygen, monitor the SpO2, which is oxygen saturation, and then monitor breath sounds, which again, breath sounds may be heard, and it doesn't rule out a pneumothorax. And you just want to be cautious of any positive pressure ventilation, like bag valve mask, because it could worsen the condition of the pneumothorax. And I actually didn't show you the picture of an open pneumothorax, so let me get to that really quick. Sorry, jumping back and forth. So say this is the chest wall, right? And that's the wound. It could be from a gunshot or something like that, but we'll just go with stabbed with a pen or a knife or something, but not so too deep. That air enters that pleural space and enters in and out, creating a sucking sound, and you want to close that up because that air can cause accumulate to the point where it causes tension pneumothorax, and we'll get to that in a second, but it pushes up on the mediastinum, which contains the heart, great vessels, which can then cause death eventually. So you want to close that up with an occlusive dressing, which would simply be something like that, and then I'll just do this. That's the tape. You want to do 3 sides, and this is your flutter valve. They obviously have commercial ones, but that's just an idea. It's on the fly one. Next, tension pneumothorax. That is when there's air in the pleural cavity. Again, going back, that's this area right in here. Air accumulates and increases the pressure in the chest. That it interferes with the cardiac function. So, it's basically how it goes. So the pressure increases as air keeps increasing. And that can occur with an open pneumothorax. If all 4 sides are closed, even if there is a flutter valve, it can occur, but if all 4 sides are taped, that can keep increasing the pressure and eventually cause this. But anyway, so pressure increases, the lung completely collapses. It pushes on the mediastinum, which contains the heart, great vessels, the vena cavas, into the opposite pleural cavity. So let me bring that up here. So basically, as air increases, and this lung really, I should draw it over here, kind of messed it up, but so basically this is over here, right? This is the pleural cavity. It's pushing on that, right? And so all this is pushing into this area over here, and so what this is doing is it's pushing on this vena cava, which technically is going to be a little darker, because it's deoxygenated blood, but it's going to be causing a lot of cardiac dysfunction, and that it prevents the blood return to the heart, which decreases cardiac output, and it causes shock, and then eventually death. So some findings with that is chest pain, tachycardia, which is a fast heartbeat, respiratory distress, absent decreased breath sounds, signs of shock, jugular vein distension, tracheal deviation, cyanosis, but these aren't always present, and tracheal deviation is late sign, so if you see that, there's definitely a lot of problems going on. Some treatment for an EMT, like I said, this is for EMT related, so the treatment would be oxygen, and call for ALS immediately and immediate transport, because the only way to really treat this is to stick a needle in the chest and do an advanced procedure, which obviously an EMT should not be doing at this point, as it's not in our scope of practice. So that's really a tension pneumothorax. It's definitely a dangerous thing, and you do not want this to lead to this. Like I said, a simple pneumothorax can lead to that. Same with an open pneumothorax and such. Finally, last one, and hemothorax, which is just blood collecting in the pleural space. Again, I'll bring it back to this. It's just that pleural space right there. It's pleural space, and it's blood accumulating. So it's a wound site, right? It's a pleural cavity. It's a wound site in there. Blood's accumulating in there from any source. Again, this is just a very simplified simplified drawing, but blood accumulates, and there's also something called a pneumothorax, which is when blood and air, so it's like a little bit of blood. I'll draw it right here, right? So I'll just basically there's some air and blood, pneumo. Some findings are signs and symptoms of shock and signs and symptoms of shock with no external bleeding or reason for shock, and then decreased breath sounds on the affected side. So that would be this side, it would be decreased breath sounds. And that is overall a pneumothorax, and some of the types of pneumothorax that may be found. Thank you.